Good morning, fellow students. My name is Catherine Tello, and today we'll be discussing why physician-assisted suicide should not be legalized in the United States. Basically, imagine yourself as a terminally ill patient in the hospital. True, you are suffering, and you might be suffering from depression, but really what we don't need is for doctors to choose your quality of life and when you should live or die. I mean, that's kind of frightening, right? Doctors, supposedly with this law, can help you die. They will give you a lethal amount of medication which you will take and you'll pass quietly. According to Derek Humphrey, in the Netherlands, this law has already been passed. There's really no crime against it, and doctors don't get punished for using this in the incorrect manner. Many physicians practice physician-assisted suicide in the Netherlands, and many have murdered many mentally ill patients and also poor patients who couldn't really afford the medical care or the bills that came with it. It's quite sad. According to the University of Washington, in 1992, in Oregon, they had passed legislation that is stated as the Right to Die with Dignity Act. This allows for the court and the patient to go through a process where they opt to physically commit suicide with a lethal dosage assisted by their physician. It also passed in 2008 in Washington. We have to start voicing our opinions and some examples of why this would be a bad idea. What if you're suffering from depression and you really don't know what you're saying? What if you're incoherent and you can't really say that you want or you don't? What if your answers change every day? There could be doctors overstepping the boundaries and asking you to commit suicide. And also you have your family pressure and feeling like you're a burden to other people. The Ethical Healthcare of Wisconsin Right has a couple of testimonies that I'm going to explain to you why this could be a really bad idea. For instance, Clarietta Day. This is an example of how a doctor can misinterpret what you're asking for in your will. She suffered from a severe stroke, and she was going through some complications, and she asked her doctor to not keep her alive with substantial machines. So the doctor brought it upon himself to go ahead and try to put her to sleep. This is what he tried to do in order to do it. He basically prescribed her a lot of painkillers and let her take that. Then he disconnected her life support and placed a magnet over her pacemaker to try to stop her heart. Throughout all these efforts, she still was breathing on her own, and she suffered quite a long death painfully. On the death certificate, it claimed that she died by stroke. This is where you don't know what the doctor's going to interpret what you're asking for. I'm sure she would have rather died peacefully than being forced upon to die like that. Another example that the healthcare of Wisconsin's Right to Life is Kate Chesney. This is another example of how family can pressure you into go ahead and signing up for physician-assisted suicide. The right to die with dignity, right? She was suffering from terminally ill cancer, and she was going through this for years. She had a short-term memory loss and was not able to be coherent and make her own decisions for her. Her daughter was trying to force her to get this physician-assisted suicide in order for her to gain her inheritance. The doctor declined her option. The doctor declined her option of doing that, and the daughter was completely upset and wanted her to go ahead and go through the physician-assisted suicide. So even your family can push you onto it and make you feel like you're a burden, even though you don't know what you're deciding or anything like that. Who's going to protect the patients? We have to stand up for it. Another example is how Miss S. She was offered physician-assisted suicide by her doctor when she didn't even request it. So now doctors are just throwing out the option without you not even asking for it. She was suffering from lymphoma, and her doctor offered her to prescribe her a lethal amount of dosage of painkillers. She quickly declined no and then stated, "He wants me to kill myself?" Then she later went home and died naturally by natural causes. died by natural causes several days later. So these are all examples of how it cannot be. So there are numerous organizations and physicians that are gathering together trying to vote against this right. We can make a difference just by trying to understand these of people who are suffering from terminally ill diseases and that are having issues with the diet of dignity or having it forced upon them. If the legislation passes through your state, you can vote no. Imagine what would happen if physician-assisted suicide was legal all over the United States. There would be many issues with this coming true. Some examples are the sanctity of life. Let's talk about it. Most of our religious values, whatever they might be, look down upon trying to commit suicide. And basically, our secular traditions have always been against it. We're always trying to fight for your life and not push for your death. Another example of where this can go wrong is passive versus active. Passive death means basically you opting not to be resuscitated or not being put on life support if there's no brain waves or comprehension that you're there. If you're still able to move and everything like that, you're still alive and there's a chance for you. But active meaning is actually them forcing death upon you, kind of putting away, murdering you. There's a difference between passive and letting you die than active of actively killing you. There's also a potential for abuse. We can have healthcare providers opt to push for you to do passive or euthanasia so you wouldn't be a burden for cost of them. Also, doctors get bonuses for their care to be cheaper and not be put on the hospital's debt bill. And your family can also push for you to do it, for you to die peacefully so they can collect inheritance. You know, this is just all such a very slippery slope and just kind of dangerous. The professional integrity of all MDs or all doctors, they all have to take a Hippocratic oath. This is part of their ethics. It means they always state that I will do no harm and I will not administer poison to anyone who asks. So these are all different ways of why it can make an issue. But there's hope. We can make an action. There has been legislation already passed in 2 states like we stated earlier, Oregon and Washington, and which have been passed and which have also been recognized by the Supreme Court. It comes to the public vote of what we would like to do. If it comes to your state, like I said, vote against it. The legislation is just too much of a slippery